Hello everyone. So I have bone and joints. Okay, so what makes someone's bones and joints healthy? The skeleton is our body's storage bank for calcium, a mineral that is necessary for our bodies to function. There are two key nutrients that will help with just that: calcium and vitamin D. Calcium is a mineral necessary for our body to function, and it is the building block of our bone tissue and our joints. Calcium keeps our bones and joints strong and healthy, and vitamin D is what helps us absorb this calcium. When our bodies are efficiently supplied with these nutrients, which is usually when we're young and our parents are providing us with all this nutrition, our joints are cushioned and able to bend while our bones are strong and dense, leaving them to work appropriately and protect us from common bone and joint diseases. Well, as people age, their bones and joints aren't so healthy anymore. By the time we reach the age 40, we slowly begin to lose bone mass. As this aging process occurs, our bones lose not only their mass, but also their density, calcium, and other minerals. Our joints become stiffer and less flexible. One common example of this is something I'm sure we've all seen. We've all seen that cute grandma that walks into the grocery store with what looks like a hunchback when really her vertebrae has lost its mineral content, causing each bone to become thin and weaken, all because of the aging process. So as you can see, the top picture shows exactly what's happening to the bones in our back as we get older. They're just weakening, which is causing our spine to collapse, which provides them with that little hunchback looking thing. And then the bottom picture shows some common joint areas that oftentimes become less flexible and more stiff as we get older. Okay, so our joints and the surrounding structures allow us to bend our elbows and knees, wiggle our hips, bend our back, turn our head, wave our fingers, and the list goes on. Smooth tissue, called cartilage, and a lubricant called synovial fluid cushion the joints so bones do not rub together. But increasing age, injury, or carrying too much weight can wear and tear this cartilage, leading to a reaction that can damage our joints and it can lead to arthritis. Along with this, our lean body mass decreases and an accumulation of calcium can occur where there's been tissue or cellular damage known as calcification. This calcification causes minerals to deposit in and around some joints. This is common in the shoulder and in the knees. The bottom left picture shows what a calcified joint may look like. So you can see the regular joint obviously has that opening where cartilage is supposed to go under there, and then the one on the right is showing a locked up joint. So fluid in the joints may also decrease. The cartilage may begin to rub together and go away. This is common in the hips and knees, and a common one that we have all seen are the fingers. The finger joints lose cartilage and the bones thicken slightly. The bottom right picture shows what happens when cartilage starts to rub away. So you can just see there's supposed to be a little width or a space in there, and then when that cartilage starts rubbing away, the bones start hitting each other. Okay. So after talking about the changes that age can make on our bones and joints, it is important to talk about how to assess for these changes. So first, it would be important to inspect the joints of the hands, wrists, knees, hips, shoulders, and so on, and look for nodules, crepitus, warmth, swelling, tenderness, deformities, and really any sign of arthritis. We would also have our patient perform different kinds of range of motion to better assess our patient's ability to move these bones and joints. We would want to be on the lookout for any type of atrophy, tremors, and involuntary movements that could indicate something a little bit more serious. Along with this inspection comes obvious palpation and manipulation in order to further assess these bones and joints. And what I mean by manipulation is just, moving the knee yourself to see if you can hear any crepitus, feel any crepitus, just manipulating their joints yourself. So when palpating and manipulating, it is important to use the opposite side of the body for comparisons. This will make it easier to spot subtle differences as well as identify any symmetrical problems. Also, while palpating the joints, note any areas of increased warmth. Although assessing for pain sounds simple, it's important to remember that although pain is subjective, we want to observe the patient's eyes while palpating these joints and the surrounding structures. A patient's expression of pain depends on many factors, and they don't always verbalize that they are in pain. It is important to ask questions such as, does the pain occur after rest or after activity? And ask them to describe the character, location, and severity of the pain. And after a thorough assessment, you'll want to go even further and have x-rays or bone scans done if you suspect anything wrong. The pictures on the right show you what you see on an x-ray or a bone scan, or what you can see, I guess. And then you can see at the bottom left picture, that's what obviously normal bone is supposed to look like. And then if you have osteoporosis, the bone is going away and you're losing all that structure. So as we age, why are we losing bone and what is making that happen? In very simple terms, bone loss occurs when more old bone is reabsorbed than new bone is created. This is called remodeling. So remodeling is continuous and a coordinated cycle of removal of old bone by osteoclast, followed by the deposition of new bone by osteoblast. But as we get older, these osteoblasts slow down and don't create that new bone, so we are really just losing bone. As you age, your body may reabsorb calcium and phosphate from your bones instead of keeping these minerals in your bones. This will make your bones weaker, leading to conditions such as osteoporosis. Fortunately for most of us, bone loss can be significantly slowed through proper nutrition and regular exercise. So in a joint, bones do not directly contact each other. They are cushioned by cartilage that line your joints, synovial membranes around the joint, and a lubricating fluid inside your joints known as synovial fluid. As you age, joint movement becomes stiffer and less flexible because of the amount of lubricating fluid inside your joints decrease and the cartilage becomes thinner. Ligaments also tend to shorten and lose some flexibility, making joints feel stiff and making it harder to be mobile and active. Okay, so what kind of education do we want to do for these patients? The biggest type of education that we can teach our parents, our patients, is that the body needs calcium and vitamin D and enough exercise in order for our bones and joints to remain strong and healthy. Anytime you ask a nurse, a doctor, any healthcare worker, what you can do to help strengthen your bones and joints, you're always almost going to hear those three things: vitamin D, calcium, and exercise. So vitamin D promotes the body's absorption of calcium, essential to the development of healthy bones. Exercise is one of the best ways to slow or prevent problems that have to do with muscles, joints, and bones. Many age-related changes to joints are caused by lack of exercise. So what does exercise do to our joints? Movement of the joint and the associated stress of movement helps keep the fluid in the joint moving. Being inactive causes the cartilage to shrink and stiffen, reducing joint mobility. Patients can also take vitamin supplements that will help with a vitamin D or calcium deficiency, but it's very important that they talk to their doctor before taking any type of supplement. Okay, so there are many food sources out there that include calcium, such as dairy products, green leafy vegetables, salmon, and sardines. So if we ever have a patient who has a calcium deficiency, it's important to just educate them on what foods there are out there before they jump to taking vitamin supplements or medication or any of that. Postmenopausal women are at increased risk for osteoporosis, and men over the age of 65 are also at risk. They're also at risk for other bone and joint diseases, but osteoporosis is probably the biggest one that I've seen, or researched at least. So they are encouraged to ingest 1,200 milligrams of calcium per day. There are factors that don't help the aging process, and that, of course, is smoking and alcohol. So too much alcohol can damage your bones. It can also put you at risk of falling and breaking a bone. And as far as smoking goes, men and women who smoke have weaker bones. Women who smoke after menopause have an even higher chance of fractures. And once again, exercising your muscles with strength and resistance training can provide better support for your joints. Balancing exercises such as yoga, Pilates, and working with a balance ball can help build stability, and stretching improves joint mobility. Okay, so this is a very simple picture that just gives us some basic things to remember that will help our bones and joints as we age. So 1, boost your calcium intake. Again, calcium. Enjoy early morning sunlight, avoid excess salt, quit smoking, say no to soda, and drink less coffee, which is very hard to do. Okay, thank you.